I'm here in Denver at the American Academy of Dermatology 2026. At this Congress, there are 13,000 dermatologists from all over the world, especially from the United States, for it's of course of the American Academy, but also from abroad, from China, from all regions of the world. And innovations are presented here. What is extraordinarily important and particularly interesting is the insights actually in clinical practice in inflammatory diseases of the skin. It started actually with psoriasis, but then also in atopic dermatitis and also in hidradenitis chronica suppurativa and in other inflammatory diseases of the skin. People realize now that early intervention is providing a window of opportunity. Early active intervention with the treatments which have been developed, the targeted treatments in these disorders with very high efficacy. So it is not so much about the treatments that we are learning more, but about the way how to use these treatments. What we have learned is that an early phase of a disease like psoriasis, but also other inflammatory diseases, there are immune components in the skin which are present and which are actually inducing the disease, but not yet components which maintain the disease. A component which maintains disease are the tissue-resident memory T cells. Tissue-resident memory T cells are CD70-producing cells which accumulate in the skin when psoriasis exists already a long time. And when these cells are there, we know that actually the disease is much more difficult to treat, that patients will respond less to the treatments. We first thought that this only was relevant for psoriasis, but now we know that this is also relevant for other diseases. So what's happening here at the AAD is firstly that dermatologists learn more about the adequate use of treatments, that is active early intervention. Already for some years we realized that we have to be ambitious. We can be ambitious for these treatments have an enormous efficacy. When we treat early and active, we also see a sustainable disease control. That is, that when patients at some time go off treatment, that their remission can be very long. Their remission can be very long, so long that in some patients we can speak about cure of psoriasis. So the value of the new treatments are not so much only evaluated at a primary efficacy endpoint of 16 weeks treatment, are not only evaluated as efficacy during maintenance therapy, but now people look more about off-drug remission. And that is an enormous development with enormous future possibilities. I think that is of major importance to realize that. Another aspect which is discussed actually in several presentations that I heard is paradoxical reactions and immune shifts. Let me tell you, a paradoxical reaction is known already a long time. It is actually a patient with rheumatoid arthritis gets an anti-TNF, and quite in contrast to what would be expected, this patient develops psoriasis. And anti-TNFs are a treatment for psoriasis. So this is paradox, it's paradoxical. Then there is another phenomenon that sometimes also is mentioned, is designated as paradoxical, but is not paradoxical, that's immune shift. You can have a situation that you treat your patient with a biologic or with psoriasis, And then you see that this patient shifts from psoriasis to atopic dermatitis. You can also have patients with atopic dermatitis, and you give these patients dupilumab, and you see that there is a shift to psoriasis. And that is not a paradoxical reaction. There's nothing paradoxical to that. It's a shift. And that is in our understanding of these diseases, psoriasis and atopic dermatitis. In earlier days, people thought these diseases have nothing to do with each other, are totally different, and you will not see any overlap. And now, with new treatments available, we see also a shift over there. Then the aim of treatments. The aim of treatments is actually a sustainable disease control. We strive to more long-term remissions. More long-term remissions can be reached actually by adequate early-on treatment. Early-on treatment gives a higher chance in reaching sustainable disease control. But also in the field of topical treatments, there are developments. And one development is a more sustainable disease control, also by the innovative new topical treatments with more prolonged remission periods following discontinuation. So, with respect to what's actually happening and what actually important future directions are, there is one aspect I would like to mention here, and that is immune profiling. In the field of research, a lot of researchers do studies on immune profiles related to the different inflammatory skin diseases, and they come to some conclusions, also the responsiveness to treatments, also actually to get more information in a disease like palmoplantar pustulosis, where there are several immunophenotypes. Palmoplantar psoriasis was earlier on just thought as a manifestation of psoriasis. We know now that it is a disease in itself, but it's a mess in terms of immune profiles. We see in patients with palmoplantar pustulosis typical psoriasis profiles. We see also profiles of more an IL-36 dominance, but we see also Th2 dominance. And that explains when we treat patients with palmoplantar pustulosis with treatments that you quite often see that about 30% of the patients have great results. For example, with anti-IL-17s in palmoplantar pustulosis, we can see that. All in all, in the field of inflammatory diseases of the skin, there is a revolutionization at the moment. And we see similar aspects in the field of oncology, where also enormous developments are there. Also, the medical intervention here with advanced cases of basal cell carcinoma and of squamous cell carcinoma are important to mention. And to sum up, I think we can say the future is bright. That is, new possibilities and new opportunities are available and will innovate actually dermatology. Thank you so much.